I'm Liz Noble. I'm a qualified naturopath here in Sydney, Australia, and today we're talking about the symptoms of glandular fever or Epstein-Barr virus. Now, when you first get diagnosed with glandular fever, symptoms tend to be the sore throat, the swollen glands, a high fever, and the fatigue. These are the cornerstones of the glandular fever diagnosis. Now, some patients get further symptoms. They can get respiratory involvement, so a runny nose or a sinus infection. They can get a cough, or even potentially problems like pneumonia or bronchitis can develop as a secondary infection. Some patients get liver involvement, so they might get a very swollen or sore liver, so the area below the right rib is quite tender to touch. Some people with liver problems will actually get nausea, poor appetite or vomiting. Others may get headaches or migraines, and in severe cases there may be a yellow tinge develop on the skin or on the eyes, which all point to liver involvement with this nasty virus. Some patients will get the chronic version of glandular fever when it lasts for many months or years. It is often re-diagnosed or reclassified as chronic fatigue syndrome, but the basic trigger was the glandular fever. And symptoms there tend to be more the fatigue. There can be dizziness and muscle pains and ongoing problems like that. Now, in children, particularly the young kids under about 5 or 6, they tend not to exhibit glandular fever symptoms. Often these illnesses aren't even picked up. They're seen as a cold or a flu, and they're not picked up till the future when a blood test might be done down the track. If kids do show symptoms, they're often the high fever or abdominal pains are also quite common. In elderly patients, again, we do find that the older the patient is, the worse the symptoms tend to be. But the very old patients tend not to get the high fever. They get more the fatigue and the muscle aches and the pains and dizziness and problems like that. So it really depends on your age when you get diagnosed to what your symptoms are going to be. Most people get over this illness within a couple of weeks to a month. If it lingers on, it often means there's something wrong with your immune system or your liver function is not working properly. If you need some ideas on how to treat your glandular fever, please refer to my ebook. I do go through the vitamins, the minerals, the herbs, the diet, liver cleansing, all the things you can do to get your body cleansed out and healed from the Epstein-Barr virus. I hope this information helps you, and best wishes on your recovery. Thank you. Remember, this advice is meant to just inform and educate you. It is not meant to replace your doctor's advice. So please discuss what I've talked about here with your doctor if you have any concerns.